Many people assume that strokes only happen to older adults, but an unexpected trend is emerging. Strokes among young people are on the rise. In the US alone, approximately 70,000 Americans under 45 experience strokes each year, making up about 10 to 15% of all strokes, a figure that continues to grow. Notably, ischemic strokes, the type caused by blood clots blocking blood flow to the brain, are the most common among these cases. Hemorrhagic strokes, which occur when a blood vessel ruptures in or near the brain, are less frequent. This leads to a big question: why are more young people experiencing strokes, and what can they do to lower their risk? In today's video, we'll explore 8 critical factors contributing to the rising stroke risk among younger adults. Be sure to watch until the end, as the final cause may be the most surprising and least well known. Plus, we'll cover the essential steps to take if you or someone you know experiences stroke symptoms. Before we begin, take a moment to like this video and subscribe to our channel for more valuable insights. And if you or someone close to you has had a stroke before age 45, please share your experience in the comments below, along with your location. Stroke is a serious medical emergency, requiring immediate attention, and it's not just a concern for older people. Understanding these risk factors could help save your life or the life of someone you care about. Causes of stroke in younger adults. While many stroke risk factors in young adults mirror those seen in older adults, like high blood pressure, diabetes, smoking, and high cholesterol, there are additional causes and unique conditions that can impact younger people in significant ways. Here are some of the key factors, but first, please give this video a like. The more likes it receives, the more YouTube will distribute it to people who might not have access to doctors or hospitals. Also, share the video with your friends and family. 1. Traditional risk factors: diabetes, high blood pressure, and high cholesterol. More young adults are now experiencing conditions like high blood pressure, diabetes, and elevated cholesterol levels, issues that were once largely limited to older populations. This shift suggests that lifestyle factors are accelerating the onset of age-related health problems in younger generations. 2. Unhealthy habits and sedentary lifestyles. Surprisingly common habits can significantly increase stroke risk in young adults. Smoking, heavy alcohol use, and lack of exercise are as dangerous for younger individuals as they are for older people. Modern technology has contributed to more sedentary lifestyles, with prolonged sitting at work or during screen time affecting blood flow, sugar processing, and fat metabolism. 3. Blood disorders. Certain people are born with conditions that make their blood more likely to clot or with structural issues in their blood vessels. These inherited conditions aren't lifestyle-related, but they do increase stroke risk. If there's a family history of blood clots, it's essential to discuss possible blood tests and preventative measures with a doctor. Research underscores this growing trend. A study in the Netherlands reported an increase in stroke rates in young adults from 14 per 100,000 in 1998 to 17.2 per 100,000 in 2010. In France, the rate rose from 11.6 per 100,000 in the late 1980s to 20.2 per 100,000 in the early 2010s. These findings suggest that broader changes in lifestyle or environment may be affecting young people's stroke risk. 4. Polycystic kidney disease, PKD. Polycystic kidney disease, PKD, is an inherited disorder in which cysts form on the kidneys, interfering with their blood filtering role. This can lead to complications in blood vessels, high blood pressure, and even aneurysms. Individuals with PKD are 50% more likely to develop aneurysms, making regular blood pressure checks and screenings essential. 5. Neck injuries and arterial tears. Minor injuries, even from simple activities or awkward movements, can lead to small tears in neck arteries called dissections. These tears can restrict blood flow and are increasingly recognized as a stroke risk factor in young adults. Awareness and changes in physical activity are likely contributing factors to this increase. 6. Undetected heart issues. Some people are born with minor heart abnormalities, like a patent foramen ovale, PFO, a small hole in the heart, or other cardiac conditions that may increase stroke risk. While advances in diagnostic tools mean more of these issues are identified today, rising risk factors in younger adults can make these conditions more hazardous. By understanding these and other stroke risk factors specific to younger adults, you can take proactive steps to reduce your risk. Stay tuned as we cover more unexpected causes, and don't miss the final reason. It may be the most surprising of all. 7. Migraines and stroke risk. Migraines, a neurological disorder marked by severe headache episodes, can do more than just cause pain. In rare cases, they may increase the risk of both ischemic, blood clot-induced, and hemorrhagic, bleeding-induced, strokes. The condition often runs in families, indicating a genetic component. Studies have shown that young individuals with migraines face a slightly elevated stroke risk, which can increase with age and with the frequency of migraine episodes. Smoking can dramatically amplify this risk, making it even more dangerous for individuals who experience migraines. For women, the stroke risk is further heightened if they take hormonal birth control pills or hormone replacement therapy. Notably, women who both smoke and use birth control face a significantly elevated stroke risk. To manage this, individuals with migraines are encouraged to take measures to reduce the frequency of their migraine episodes. Medications are available that can help prevent migraines, and consulting a headache specialist can be a proactive step in stroke prevention. Talking to a healthcare provider about ways to lower the frequency and intensity of migraines may also be beneficial for long-term health. 8. Birth control and hormonal therapy. With an increasing number of women using hormonal contraceptives and hormone therapies, understanding the stroke risk associated with these options is essential. Although birth control pills and hormone therapy are generally safe, they can slightly raise the risk of stroke. When smoking is added to the equation, this risk becomes considerably more pronounced, and the danger increases for younger women who may not typically be seen as stroke candidates. This combination of factors contributes to the overall rise in stroke cases among young adults. Another complicating factor is the issue of symptom recognition. Doctors are quick to suspect a stroke in older patients, but for younger adults, stroke symptoms can sometimes be mistaken for less serious issues. As a result, younger people may experience delays in getting critical medical help. Alarmingly, statistics show that women under 35 are 44% more likely to experience a stroke than men in the same age group, highlighting the importance of awareness and timely medical intervention. Recognizing stroke signs and reducing risks. One of the biggest challenges for young adults is recognizing stroke symptoms and seeking immediate help. Because younger people don't typically expect a stroke, they may ignore early signs. However, swift treatment is crucial, as every minute counts in preventing brain damage. Doctors now emphasize the BEFAST method for recognizing stroke signs, balance issues, eye or vision problems, facial drooping, arm weakness, speech difficulty, time to call emergency services. Regardless of age, recognizing these symptoms and acting quickly can make a substantial difference in recovery outcomes. Stroke prevention in younger adults. While stroke remains a leading cause of death in the United States, about 80% of cases are preventable by managing risk factors. Practical ways to lower stroke risk include regularly checking blood pressure, blood sugar, and cholesterol levels, as well as screening for atrial fibrillation, AFib. Regular physical activity, such as setting daily step goals or tracking food and drink intake, can help reduce the likelihood of stroke. Reducing alcohol consumption, quitting smoking, and making gradual improvements in diet and exercise also have a powerful impact on lowering stroke risk. While lifestyle changes can be challenging, Gradual improvements, like moving more each day and monitoring health metrics, can help protect against stroke and improve overall health. The increasing incidence of strokes in younger populations is a reminder that age alone doesn't offer protection. But by paying attention to risk factors and acting proactively, young people can significantly reduce their chances of experiencing a stroke. If you found this information helpful, let us know in the comments below. And if you're interested in more, consider subscribing for updates on health insights and recommendations. Thank you for watching, stay proactive about your health, and see you in the next video.